Pros, save more on the materials you need to get the job done inside and out at Lowe's. Right now, get 10% off in-stock Trex Naturals decking, now available in more styles. Plus, get 15% off select custom entry, interior, and storm doors. Then, we'll deliver it all straight to your job site to help keep your jobs moving. Get the brands pros trust, priced right, and ready when you need them. Our best lineup is here at Lowe's. Valid through 5/27. While supplies last. Selection varies by location.
Welcome to the Medical Nursing Podcast, the go-to show for vet nurses and technicians passionate about internal medicine. I'm Laura Jones, a registered vet nurse, all-around medical nursing nerd, and your guide to breaking down complex medical diseases into simple, actionable chunks. Each episode is packed with knowledge and tips that you can start using right away to give even better patient care. So let's get started. Hello, and welcome back to the podcast, or a very, very warm welcome if it is your first time tuning in. You are listening to episode 114 of the Medical Nursing Podcast, which is the podcast where we chat all things medical nursing and how you can use more of your skills to advocate for your patients regardless of the clinic you work in. I am so grateful that you have joined me for the final episode of Veterinary Nursing Awareness Month 2026. And as I record this, we are closing out a month where we really come together as a profession to celebrate everything that we do, or we can do, and to shout loud and proud about our veterinary nursing skills, knowledge, and care. And in this episode, I want to share my brutally honest reflections on veterinary nursing, where we've been, how far we have come so far, and where I think we need to be heading next. In the last few episodes, we have chatted about the evidence, we have shared all of the studies, we've heard what our vets have to say, and we've generally chatted lots about what we can all do right now to get more from our careers. But now it's time that I sit down and have a proper chat with you about the lessons that I have learned from almost 20 years in this profession. So grab a coffee if you haven't got one already, and let's catch up. So 20 years is a long time to watch a profession evolve, and it really hasn't always evolved in the direction that I expected it to. Now, I started in this profession at 17 years old. I, some of you will know, dramatically quit my A-levels midway through college, went to work in Tesco, bumped into a veterinary nurse who was coming into the shop to buy her lunch, and ended up taking a student nurse job at the practice a few months later. So I was really a child when I started nursing, and I was enthusiastic in a way that I think really only 17-year-olds can be. So I was incredibly naive. I really didn't know enough to be scared yet, which in some ways when I look back is helpful, but in a lot of ways it's also quite worrying. Now, one of the biggest things that held me back early in my career was actually myself, and I think this is probably true for a lot of us. Now, I'm sure that some of this was age, but I'm also sure that some of this was working in clinics where at the time nurses were still seen as beneath other roles or as a bit of an optional extra. For me personally, I wasn't raised in a clinic where nurses really spoke up, and I think that's because at the time, nurses didn't necessarily feel as empowered to speak up as many of us do now. And what I want to do is share a few kind of standout moments in my career, good and bad, that I reflect on still now, quite a few years later, and that I think really have taught me a lot of lessons that I still take forward in my career now. So the first one is one that I reflect on a lot, and that is actually the first anaesthetic that I ever did. So this is very early in my student nursing days. It was before I had actually started college. So where I worked, I did the apprenticeship. You have a 6-month period where you kind of train at work. You're learning from the people around you, you're learning more practically, and then the next intake enrolment opens for college, and you then start training once a week at college. So I had no theoretical knowledge past what I had learnt from the people around me. And I was actually approached by the vet while I was on my lunch break at the time. We didn't have like a separate staff room at the time, so we had like an office/staff room. So I was eating my lunch in the office, and he came up to me and asked if I could give him a quick hand, basically. So I thought I'd just be a few minutes. I said yes. I followed him into the prep room where he asked me to hold a cat. So I held the cat. Assuming I was just holding for a quick IV, that's what I did. And then I watched the vet induce her, then asked me to hold her for intubation. And then before I knew it, I was monitoring a GA. But it wasn't just a GA, it was my first ever GA, and it was a GA that I was monitoring on my lunch break, completely unaware of what I was doing, without another nurse around to ask questions or for support. It was a case of do a heart rate, count this over 15 seconds, tell me what the number is, put the dial on 2 or whatever. But the problem was that I didn't really know what any of those numbers meant. I didn't know what the dial was really doing. I had no frame of reference as what that number meant for that patient. I was 17 with a short period of in-clinic training, no college yet, and a cat under GA depending on me to monitor her safely. And at the end of it, when the cat woke up, I genuinely did feel quite conflicted. So in some ways, I was very proud that I had done an anaesthetic for the first time and it had gone well. But mostly I felt like I was put in a situation that I should never really have been in, and one that could actually have been very dangerous. Now, I'm sure the vet would not have put me in that situation if they didn't feel that they could support me. But for me personally, as the one doing the monitoring, I came away with a sense of, well, I'm glad that went well, but I should have said no, or I didn't feel like I was able to say no. Now, I'm not saying this or sharing this reflection to throw shade at the team I worked with, because genuinely they're great. I still enjoy seeing them around at events and I have a lot of fond memories of my time training. But my point is that back then, that was the culture. In many clinics, that was quite normal. It was just how things were done and it wasn't really questioned by people. And the biggest lesson that I've learned from this situation is that you need to speak up, you need to confidently question things and be clear about what you can and cannot help with. Because for me now, if I don't feel confident doing something, or it's been a while since I have performed a particular task, I will happily say no, and I don't see that to be a bad thing. I don't see my saying no as a reflection on my skills or lack of skills. In fact, I feel like it's quite the opposite. I personally feel like I am a better nurse for knowing when to say no and making sure that I'm always putting my patient's need first. If I had the opportunity to go back to 17-year-old Laura and do that situation again, I want to share how I would approach it. So first of all, I would say that I'm on my break. That's something that I just didn't do because I didn't really feel like it was possible to say no. And we definitely used to wear overwork like a badge of honour back then. And I know that is changing now, but sometimes we still do. But I now am much, much more aware that by looking after my own needs, I am better able to care for my patients. Now, I'm not super rigid with my boundaries. I will still take shorter breaks sometimes to get things done when I feel I can. So last week, for example, we were in a situation in the practice that I was working in where I ended up having to cut my lunch break short. Otherwise, a patient that I was going to be monitoring wouldn't be able to get their ultrasound. I had had a 20-minute break by the time that message came through and I had had a chance to eat my lunch. And I asked myself, do I genuinely feel good about cutting my break short right now and can I take the time back later? The answer was yes, and so I did it. So I'm not saying we always have to say no, but saying I'm on my lunch break at the moment, if no one else is free, I can help you in however many minutes time is not a bad thing. So definitely speak up about your breaks. Secondly, I would make sure that I know what I am helping with. I would ask the vet what their plan is or ask them what I am helping with rather than just saying yes. If I didn't feel like I was able to help, so like in this situation, for example, where I didn't have the training, I would say so. I would ask if they could wait until another nurse was free because I hadn't done any anaesthesia yet, even with another nurse supervising me. If I could help with whatever they were asking of me, I would still take a few minutes to check that everything was ready and where everything was, so that if something went wrong or something changed, I knew where everything was and I could confidently manage the situation. So even now, if I am monitoring an anaesthetic and someone else has prepared the equipment for me, I will still take a few moments and just double check that I have everything, check the machine myself, because I want to know for me personally that I'm completely confident going into that situation. If I was supporting another student nurse who was put in this position, I would speak up for them. I would say gently but clearly to the vet or to whoever was delegating the task to them that this individual has not been trained to do this yet and they need to be under supervision from a RVN. And then I would get them into that prep room for every single anaesthetic that I could, but with the right support. Someone there with them explaining what the numbers mean, what we're watching for, what's normal, and how to intervene if there's an issue. Learning should be an empowering process for everybody, not feel like you've been thrown in at the deep end. And if it feels otherwise to any of us, we should all feel empowered to speak up about it. The next reflection I have is on where confidence comes in as veterinary nurses, where we have been, and what I think needs to change going forwards. And I think that a big part of being seen as the skilled, knowledgeable professionals that we are is having the confidence to really own that. And that is something that I have seen change for the better over the last 5 or so years especially, which is amazing to see. But for a long time, I did not own that confidence. For years, every time I raised a concern with a vet, I used to almost apologise for it. I would say things like, "Oh, I'm so sorry to bother you, but I've just noticed," or I would phrase my concern as a question so that I'm asking them if I'm right rather than confidently sharing an important observation. It kind of felt almost like I needed permission from someone who knew more than me to have an opinion, and I understand why that's the case. I think a lot of us come into this profession with almost that kind of instilled in us, and that might be because of the culture in a clinic that we were impacted by, or it could just be the historical dynamic that there has been between the role of the vet and the role of the nurse, and it could also just be our personalities because we are caregivers and we tend to put others first. And don't get me wrong, this is one of the best qualities that I think we have as veterinary nurses, but all of this can also make us default to acting small in the moments where we need to do the opposite, where we need to go in, be confident and take up space. What I didn't realise at the time, and when I reflect back on it is actually something that still makes me quite sad, is that every single time that I shrunk like that and I devalued myself, I was reinforcing myself that I wasn't worth as much. I was telling myself without meaning to that my opinion wasn't worth much, or that I was probably wrong, or that my thoughts, my opinions were wasting the vet's time. And over and over and over, without meaning to, I negated my own worth, my own knowledge, and my skills as a veterinary nurse by telling myself as well as showing others that I didn't value them. And the knock-on effect of that is that people believed it. People around you pick up on your confidence. And when I portrayed that I didn't believe in my own observations, my colleagues were of course going to be less likely to take them seriously. That's not because they're dismissive of my opinions, but it's because I'm telling them that I'm wasting their time by saying, "I'm so sorry to bother you, but I think this." And the moment that I stopped apologising for my observations or my clinical opinions, that's when I felt like the way people saw me really changed. Because the truth is that we all know that veterinary nurses are highly skilled, highly knowledgeable professionals, and we have highly valid opinions to share. And without them, the rest of our colleagues can't do their jobs, because we all need each other, regardless of role in our practice, and our patients need all of our collective brains to get the best care. So if I have one thing to share with you from this reflection, it is please, please, please do not apologise for your skills. You are not wasting anybody's time, and it is far better to shout if you're worried for no reason than not shout when there is a very, very real reason for you to do so. Worst case scenario is you pull someone over to look at a patient who's actually fine. No one has been harmed. And most importantly, the patient has had eyes on them and the patient is okay. The alternative is much, much worse than that. I think one of the most dangerous assumptions that we can make is really that someone else knows all of the answers. And I think often we as veterinary nurses can default to feeling like that. But the reality is that we are all human beings. Every single one of us, vet, nurse, PCA, front of house, whatever, only have so much room in our brains for a certain amount of information. It is not physically possible for us to keep all of that information in our heads at one time. This means that we all need the thoughts, ideas, and opinions of other people on our teams to do our jobs well, and that is the beauty of being a team and working together. The next thing that I want to talk about flows on from this quite nicely, and it's actually about the importance of believing in yourself as a veterinary nurse. Because you will know if you've listened to other episodes within the podcast, especially when we first started back in 2024, you'll know that I've often referred to myself as feeling at times like a bit of a square peg in a round hole. I definitely felt like that for the first half of my career, and there was a time where I felt like that was quite normal. And I think many veterinary nurses, myself of course included, can think that we need to settle in a role rather than find one that really, really ignites our passion within nursing. And we can end up feeling like that square peg quite often. There are definitely a couple of moments in my career up until now where if things were different, I would not be a veterinary nurse. And if I wasn't a veterinary nurse, this podcast wouldn't exist. The patients that I have been able to care for and advocate for wouldn't have benefited from my particular nursing, and my whole career would look very, very different, and I definitely wouldn't be as happy. I had a conversation early in my career. This was when I was working in a branch clinic. I was working with the head vet at the time, and I remember it really, really clearly. I was in the X-ray processing room /lab/autoclave room, which was like a kitchen in an old converted house. And if you've been in this profession long enough, you'll appreciate how hard processing X-rays was back then. I was elbow deep in a dark box because digital X-ray was not a thing that we had. I was fumbling around with my gloves in this box trying to get a cassette open and get the film out of it and put it through the processor while completely unable to see what I was doing. And at the time, I had been struggling a lot with the training. I massively felt like I didn't fit in, not at that practice, not in the profession, not in any of it. I really had been wondering whether I was cut out for veterinary nursing and whether I knew enough to be a good veterinary nurse. I spent a lot of my training really doubting my abilities and my skills. The head vet who I was working with on this set of X-rays, who was my assessor at the time, came through to get the X-ray, saw me looking upset and asked me what was going on. And so I told them. And they said something along the lines of, "I agree, I'm not sure if this is for you either." Now, they weren't saying that to be horrible, they were saying that to be supportive. I genuinely believe that they meant well and they were giving me permission to leave if I needed to, instead of feeling trapped in a role that was making me sad. But at that moment, that sentence confirmed those niggly little self-doubts that I had. So much so that about a few months later, I actually nearly left, which ended up me delaying my training by 6 months. So I qualified 6 months later than I had originally intended to. Now, obviously, I didn't leave the profession, and obviously I did not leave that role. I finished my training. It wasn't because of a sudden rush of clarity or any kind of dramatic turning point. Honestly, I actually think it was more out of stubbornness because I didn't want to give up. And also, I had a really, really supportive nurse from the local branch clinic, which we worked very, very closely with. And she helped me really see that I could do this, and I was able to get through the rest of my training with her support. I am so glad that it ended up working out okay, because of course, if I had walked out of the profession at that time believing in those self-doubts, my life would look very, very different, and I am certain I would not be as happy in whatever career I was in as I am now. The lesson here is that I wasn't in the wrong, but I also wasn't being honest about what I needed, and I think that that is something, especially when training, that veterinary nurses often don't think they can be. Because the truth is, I didn't need to leave the profession, but what I did need was a different environment, a different way of learning, and a different kind of support so that I could believe that I was capable. In reality, if we don't believe in ourselves, no one else is going to do that for us. That vet was not being unkind. They were responding to the version of me that they were seeing in front of them. They were responding to what I was saying, and that version of me was full of self-doubt and didn't feel like she belonged in that practice or didn't feel like she belonged in the profession. You have to believe in your knowledge, in yourself, in your skills, and in your value, because it is the biggest thing, undoubtedly the biggest thing that will get you through your career, especially when times are hard. So even when times are hard, really cling on to that belief in yourself and what you can do and the difference you make. This episode is brought to you by the Foundation Award in Medical Nursing. The Foundation Award is my very own 12-month on-demand course designed specifically for veterinary nurses and technicians who want to feel genuinely confident nursing their medical patients. If you've ever felt overwhelmed by a complicated case, or like you're just ticking boxes on a hospital sheet rather than truly understanding what's going on with your patient, then this course is for you. The Foundation Award goes beyond just throwing information at you. It gives you a real framework for turning your knowledge into hands-on, patient-centred nursing care that really uses your skills. You'll work through it in your own time, with live case-based support built in, so you are never learning on your own. If you're ready to go from feeling stuck to leading care with confidence, then head on over to the website and check out the Foundation Award. You can find the link in the show notes. And now, back to the episode. Over the past almost 20 years, I've seen our profession develop in so many amazing ways. We now have better qualifications and more access to different qualifications than we ever had before. We have access to specialist training, from VTSs to certificates. We can present and publish research, speak at conferences. I could go on and on. And also the standard of our student nurse training has risen enormously. We have professional registration and accountability. We have veterinary nurses that work specifically in emergency and critical care, medicine, oncology, dermatology, ophthalmology, neurology, cardiology. I could go on. These were all roles that didn't really exist for nurses when I was starting out. Certainly not publicly enough for most veterinary nurses to know about. And all of that is absolutely amazing, but despite that, there are still areas where we can improve. And I have so much hope that those improvements are coming. For example, the legislation that governs what we do in the UK, which is the Veterinary Surgeons Act, was written in 1966. It is, and I am saying this very aware of how wild it sounds, older than I am by quite a bit. At pretty much 60 years old, the Act is significantly outdated, and for most of my career, it never really felt like it was going to change within my professional lifetime. But now we are seeing progress, and for me personally, I could not be more excited about it. The BVNA, so the British Veterinary Nursing Association, has been providing the sole veterinary nursing representation in a working group led by the UK government, calling for long overdue protection of the veterinary nurse title, greater recognition and utilisation of our skill set, clearer routes for role progression, including the retirement of Schedule 3 and an overhaul of that outdated VSA. DEFRA also launched a consultation on reforming this Act at the start of the year, and the RCVS described it as a once-in-a-lifetime opportunity for us to genuinely, truly dictate what comes next in our profession. And then in March of this year, just a couple of months ago, the same month that that consultation closed, the CMA, so the Competition and Markets Authority, published its final report on veterinary services. And this is a big deal for a lot of reasons, but for veterinary nursing specifically, it gives even more weight to the importance of our role. Because the CMA, in their report, called on the UK government to protect our title and expand the legal scope of our role. This external body took a look at our profession from the outside in and said that our title was important enough to protect and that we need to be given more opportunities to reach our full potential. And not only did they do that, they confirmed that our patients, their caregivers, and our profession all need that. And that is huge. For me personally, I would much rather focus on that positive outcome from the CMA investigation than many of the other outcomes that we have seen from the CMA investigations, such as adding fuel to the social media vet bashing fires that often pop up. Because the truth is that we are highly skilled, highly knowledgeable professionals, and external bodies now are crying out for us to be recognised as such. I am confident that because of all of this, title protection will come, legal reforms will come, and we will move even further forward as a profession. We are so much closer to this now than we have ever been before, and I can't wait to see where things go next. Closely linked with this talk of reforming Schedule 3 and the skills that we can perform is the topic of cat castrates. And I think that this can be a bit of a polarising example of our skills. It has been used quite a bit as a bit of a benchmark for what we can do, and I want to gently challenge that opinion today. Don't get me wrong, I have shared a lot of amazing things about the profession and what I think is really positive, and there's been so much positive change, especially recently. But there are things that we have also moved backwards on over the past 20 years. And of these, cat castrates are probably the most talked about example. And I will say right now, I have never done one in my life. However, I worked with nurses who used to do them all of the time legally when they were on the list of veterinary nurses before the register was a thing. Back in the day, veterinary nurses used to do this procedure all the time. The skill was taken away and lots of people want it back. And I understand completely why people want it back. And I know that many veterinary nurses online have spoken up about nurses getting the opportunity to do this again. No one wants to be de-skilled or not have the opportunities to perform tasks that they used to do regularly and do very well. But even if it sounds controversial, I want to offer an alternative opinion on this, because I think sometimes we have let that one procedure become a bit of a symbol for all of the things that veterinary nurses can do. And for me, speaking as an individual, I would much rather have a conversation with a vet where I can share my professional opinions and have them respected, or I can ask to place a feeding tube or ask if we can start a patient on antiemetics, for example, than castrate a cat. And yes, I know I'm a medicine nurse and I don't like surgery, and so it's not surprising that I'm going to not be bothered about cat castrates. But in my opinion, I think we need to focus less on perhaps those specific tasks and focus more on where and how we have the opportunity to apply our knowledge. Because of course, yes, cat castrates are one way that we can do more as registered veterinary nurses, but there are so many more ways than that. We can do things like feeding tube placement, we can make empowered nursing plans, we can do ultrasound scans, we can run nurse-led clinics for all patients, not just preventative healthcare. We can provide palliative care support, physiotherapy, we can manage anaesthesia in a more nurse-led way. Now, I could go on and on and on about all the things we can do and should do, but the list I would come up with would need an episode in itself, so I'm going to cut it short there. My point is, we can do much, much more than we think, and if we think of our skills in those specific practical tasks only, then we are selling ourselves short. The proposed reforms to the Veterinary Surgeons Act would replace Schedule 3, which is the part of the legislation that governs what we can do as veterinary nurses, with flexible powers that allow the regulator to decide which veterinary acts we can undertake and under what conditions. Now, this is interesting because this could actually remove the requirement for the delegating vet to work for the same employer or on the same site as the nurse. And the wider implications of this are actually massive, because it would open the door to formal recognition of more specialist qualifications and statuses that allow veterinary nurses to do more. So we can have things like nurse practitioner roles or via community nursing. In human healthcare, the nurse practitioner has been around for a long time. Those nurses can see people on their own, they can do consultations independently, they can prescribe certain medications, and they have more legal kind of autonomy, scope and power than what a standard nurse would do. This is where I have personally wanted to see our profession go for a long time, because the scope of our role, the autonomy that we have, and the recognition of our profession in its own right will all improve as a result. The last reflection that I want to share with you this episode is that simple and easy are not the same thing, and simplicity in our role is not always bad. And I think this is an important misconception to talk about, because one thing that I often see in our profession is the idea that the more technical or skilled or advanced something is, the more valuable it is. And I completely understand where this comes from and why this can be seen as a default. Because if we think about where we have come as veterinary nurses over the past almost 20 years, we have spent a long time fighting to be recognised as skilled professionals rather than just helpers or just the vet's assistant. And I'm air quoting very hard right now. Of course, because of this, we want to highlight the difficult things that we can do. Of course, we want people to know that we can put in a central line or interpret a blood gas or monitor a critical anaesthetic or whatever else. But somewhere along the way, the focus shifted to that so much that basic nursing, for want of a better word, started to feel a little bit like it was something that you just did until you were doing the real proper stuff, the technical stuff. And I don't think that that could be any more untrue. And what's really interesting as well is this is something that I have come to appreciate the most as I have got further in my career and worked in bigger clinics that saw more complex cases and we did more flashy things. In reality, if I think day to day about what the most important things are that I do for my patients in practice, they are the simplest things. They are things like really examining my patient and flagging a concern, or taking the time to change the way that their kennel is laid out so that they are more comfortable, or calculating how much they've eaten in the last 48 hours. So I've got that information and I can take that to the vet so that we can change the way we approach that patient's nutrition. Or it might be taking the time to calm a nervous patient and build a relationship with them so that they trust me and I can then nurse them more effectively. None of those things are flashy, but all of them are really important nursing care, and I would much rather be spending more of my time doing that than doing the big flashy hands-on practical things. The fundamentals are not the boring bits that we do while we wait to do something impressive. They are the things that add up to make the biggest difference to our patients day to day. And a veterinary nurse that does the fundamentals brilliantly is not one that hasn't learned enough yet. They are one who absolutely understands what nursing is. Simple is not always basic, and I honestly think we need to spend a lot more time celebrating those quote-unquote simple skills. To round up this episode, I want to share where I think we are heading. So what are my predictions for the years ahead? So I genuinely think that amazing things are coming for our profession, and while we have heard that change is coming for a long time now, there really does feel right now that there is more momentum behind it. I genuinely think that we are heading for title protection because there is a massive weight of evidence behind the argument, and of course there's those big professional bodies now behind us as well. Similarly, I do think we will see a Veterinary Surgeons Act reform soon, and I cannot wait to see this recognise our skill set in its own right and free us from always working under the direction of a vet at our practice. I'm excited to see how the community benefits as a result of this, as well as our wider profession. We are heading for a profession where our clients know our names, know our role, and truly understand what we do. And after years of us being seen as kind of the magical people out the back that do all of the care without any of the awareness, I cannot wait to see this continue to improve. And I also think we're heading for a profession now where the question isn't, can the vet nurse do this, but also is, who is best placed to do this for this patient right now? Sometimes that will be the vet, sometimes that will be the veterinary nurse with the experience and the relationship and the knowledge to do it better. Because it's not about who can do the specific things in terms of role, it's about what is the best thing for the patient. I also think we're heading into a profession where that student veterinary nurse walking into the prep room for the first time is not thrown in at the deep end, but is empowered to speak up themselves when they are concerned to say no, or if they feel they are unable to help. One where the culture is one of learning rather than sink or swim. And I think that we are heading for a profession where we truly believe, that we are worth more than sometimes we act like we are. But really importantly, none of that happens on its own, because the legislation can change and the title can be protected, but that doesn't mean very much if we are still apologising for raising concerns in practice, or shrinking in the prep room, or deciding that our opinions probably aren't worth saying out loud. The external conditions in our profession are finally catching up with where we have truly been as veterinary nurses for a long time, but we now need to catch up with ourselves. Because change happens when we speak up if something isn't safe, when we advocate for ourselves even if it feels uncomfortable, when we invest in our own learning and we push for the environment that we deserve, and when we find our confidence and use it, or if we nurture the confidence in the nurses that we are mentoring. And it happens when we stop apologising for having a clinical opinion and we trust ourselves. My career as a veterinary nurse has tested me in ways that I did not expect, and it has built me up in ways that I couldn't have predicted. I've doubted myself in dark rooms. I've had moments where I thought I had ruined my entire career forever by taking the wrong role. I've learned from patients and vets and nurses and students, and from every single uncomfortable conversation that I finally stopped avoiding. Veterinary nursing has been the making of me, even though it's been hard at times, actually, especially because it's been hard at times. So if you are somewhere in your career right now where things feel hard, or where you feel like the square peg, please hear me when I say that feeling does not define you or your worth. It might just mean that you need a different environment, or more learning, or a better team around you, or that you haven't found your corner of this profession yet. But what it doesn't mean is that you don't belong here. So happy Veterinary Nurse Awareness Month, and here's to another 20 years of progress in our amazing profession. Thank you so much for listening to another episode of the podcast. I hope that this has given you a dose of inspiration and a reminder of just how valuable your knowledge, your skills, and your clinical opinions are. If you have found the episode useful, please share this with your teams. I think that this is a message that all of us need to hear this month and every single month in practice. Pop it in your practice group chat, share it with your nurses in your WhatsApp group, And also, the very, very best way that you can help me continue putting out more episodes like this is to leave a rating or review of the podcast on your app, and also subscribe or follow the podcast on your player as well. Thank you so much again. Happy Vet Nurse Awareness Month. Keep doing amazing things, and I will speak to you very, very soon. Bye. If you've made it this far, then thank you so much for listening all the way to the end of the episode. And I have one more thing to ask of you before you go today. I would love to hear from you. Yes, you. I love hearing about the cases that you're seeing, the skills that you're using, and the conditions that you want to learn more about. Drop me a DM on Instagram. I'm at Vet Internal Medicine Nursing, and don't be shy. Come on over, say hello, and tell me a bit more about you. Talk to you soon.